Hi, everyone. Okay, here is the lecture for Chapter 11, Eating Disorders. Normally this week, if we were in class, I would start out the week by giving you the self-questionnaire that I posted in Canvas, so please make sure to take the time to do that, and I wouldn't collect it. So it literally is just for your own information to see where you stand on your own eating attitudes with how you feel about food. The other thing that I wanted you guys to watch is a video that I posted. It's actually a compilation of some pretty dated, actually, Oprah Winfrey interviews that she's had over the years with one particular guest, and her name is Rudine Howard. I really want you to watch it. It's about 10 minutes long, and it kind of shows you the other side to things in terms of what eating disorders looks like. Because as we go through today and we look through the lecture and the slides, it doesn't really show you the whole emotional aspect to eating disorders, which eating disorders is very emotional. And some of you in class may have even dealt with it personally, either yourself or somebody that you know. And you know that if you have done this, it's a hard thing to overcome. It can almost be related to a drug or an alcohol addiction, some sort of addiction. It has a very similar mechanism in terms of how the brain is involved. However, it's a different outlet. So as we go through today, you're going to probably understand that a little bit better. And it's a fascinating topic. I wish we were in person right now and talking in class, because it's such an important topic that a lot of people don't like to talk about out in the open. So, but it's something that a lot of people are struggling with internally. Okay, so one of the things that, and I'll post this also, it's a video, it's called the Dove Evolution video. It's pretty interesting if you watch it, and it's basically talking about, it shows you a model and what she goes through, and it's like only 3 minutes long, a couple minutes long, and it shows you what she goes through when she first gets to, get her makeup and hair done, and towards the end, and it's all fast, and it does it like time-lapse photography, basically. Wow, it's pretty amazing, and what Photoshop and makeup and hair can really do for a person, and how we perceive that as society and what we see on billboards and in magazines and all that. So one of the questions that I would ask you in person is, why do eating disorders exist in the first place? And part of your assignment is actually answering that question. Who in society portrays this? And one of the main things that I always hear is media. And I think especially nowadays, with so many people being heavily involved in social media and what we're seeing online, just constantly being bombarded with these images of how one should look or shouldn't look. And it's just on a daily basis, it seems like. There's diets, that are so many out there that are just, constantly we're being bombarded with that as well, through our social media feeds. So that has a lot to do with that. Also the need for social acceptance, and what's, that means is basically like in our community and, in our daily lives, what do we perceive as being socially accepted? And a lot of that has to do with the pictures that we're seeing, online and magazines and all that. There's a lot of different other reasons why somebody would have an eating disorder. One of the reasons that I don't think the book so much talks about, but I think it's an important thing to note, has to do with stress. And, when we say somebody's stressed out, oftentimes food is involved. It's either an overconsumption of food or maybe lack of food, depending on the individual and how they, deal with stress. And one of the things, a good example that I can give you, and actually this is specifically in your assignment this week, is think about that perfect student, right? So you have a student that on the outside, they're getting straight A's. It looks like they've got everything going for them. They're popular. They've got all the friends. You go online and you look at their social media accounts, and they have so many friends and all these likes and all this other stuff. Those individuals oftentimes are the people that suffer from eating disorders. It's really interesting. And it has to do with the fact that Either, on the outside they have this like perfect looking life, but on the inside they're not. And also it has to do with pressure. And an example of this would be if you're in high school and, let's say your parents are very strict with how you're doing in school and all the things you're involved in, that can actually lead to a pressure and a lack of control for the individual, because eating disorders have a lot to do with control. So if you feel like you have a lack of control in your life, the one thing you can control is your food consumption, whether you have it or you don't have it. And it's interesting how the brain works and the psychological aspect behind it, but that could be another reason as well. You probably have seen magazines that look similar to this. I have to say, like when I'm in the store, in the grocery store, which doesn't seem as often nowadays, but I know like when you go to check out, there's just, rows of magazines and you see similar pictures that look like this. And again, if we were in class, I would ask you guys, do people actually look like this? Do these models really look like this? And the answer is no, because there's a great little tool online called Photoshop, or a program. And every magazine seems to use this. Now, I have a story for you guys. It's not listed on here, but it's called Self Magazine, SELF, and it's a women's magazine geared towards women. And it really it's kind of like a health magazine, talks about exercise and health and nutrition and all that. Well, they, for years, have told everybody that they do not use Photoshop on their models on the front cover. And they kind of were well recognized for that. Well, a few years back, Kelly Clarkson was interviewed, and she was on the cover of the particular month of that Self magazine, and they showed that picture to her, and she said, "You know what? This is not me. I did not look like this when I was there taking those photos. They Photoshopped me." And she was able to point out the different parts of her body and all that. And so that goes to show, even the magazine that told everybody that they never Photoshopped still did that. So it's one of those things that we are dealing with on a daily basis. We see this all the time. And unfortunately, society has this perception of what we all should be looking like on the outside. And as we know, when we talked about obesity in this class, we talked about how it has nothing to do with what we look on the outside. It's more of what's going on the inside in terms of our health. So this chapter is going to go through 4 specific eating disorders. What I really want you guys to note as we go through is basically the characteristics for each eating disorder. We're going to be talking about anorexia, bulimia, and binge eating disorder, and another one called pica. Okay, so what I recommend you do is when you're taking notes, write those 4 down and write characteristics as we go through. All right, so the first one is called anorexia nervosa. And this particular eating disorder, and if you watched the video, which you should have, you saw this happen to Rudine. Somebody who has anorexia believes that they are never thin enough. They actually have something called body dysmorphia, which is number 3 right here, very distorted body image, where this person can look in the mirror and whatever everybody else sees from the outside, they may look thin to everybody else, but to themselves, they never are thin enough. And we saw this really heavily with Rudine in the video. So it's an intense fear of gaining weight or becoming obese, a very irrational fear, I should say, of eating food and calories. Everything is a calorie. Everything is a number. Food is not nutrition in their mind. Food is a number. It's a calorie, which calorie to them means gaining weight. So it's a very irrational fear of food in that sense. They severely restrict energy intake relative to requirements. So they have a restriction of food. And it can be very detrimental to your health, obviously, if you're not getting the nutrition that you need. And we saw that in the video. These are all the warning signs of anorexia. If you have a friend or a family member who you're suspecting, these are the things to look for. One of the things that I'd like to point out on here has to do with say if you were to eat a meal with somebody who's anorexic, they oftentimes will put on a show, that's the only way I can describe it, of them trying to eat food when they're really not. So they may take their plate and move it around with their fork. They may cut up food into very small pieces. They may even put it in their mouth and pretend like they're chewing it, but just kind of hold it to the side of their cheek, spit it out in a napkin when nobody's watching. So it's a facade. It's getting everybody to believe that you're actually eating food when you're not. So that's a big warning sign. If you see somebody doing that when you're eating with them, that's a big warning sign. Oftentimes they'll withdraw from friends and family just overall because they have this secret that they don't want anyone to know about. Sometimes we'll have sleep disturbances. All these other things make sense. It's basically when you're lack of nutrition will equal these things. Hiding and storing of food. This typically happens with anorexics, but also with bulimics, which we'll talk about next. It's a dirty little secret. That's quote unquote, and they don't want anyone to know that they have this secret. So oftentimes hiding food, storing food. Now with an anorexic, they may hide it and store it because they don't want to eat it, and they don't want anyone to know that they didn't eat it. With a bulimic, it's a different situation where they might hide it and store it, and then they eat it secretively in large amounts. So that's a different. We'll talk about that next. This last one on here is amenorrhea. And that means that women who are anorexic have amenorrhea. It's when they are stopping their menstrual cycle. And that is a big red flag. If you think about it, your body is literally shouting out to you, telling you that you need to get nutrition in your system. Your menstrual cycle has stopped. That means that you are not healthy enough to bear children. And that has to do with lower body fat percentage. When you don't have enough body fat on your frame, your body starts to slow down, your metabolism really starts to slow down, you're going into starvation mode, and you may actually altogether stop your menstruation. Here's an example of a day's worth of food for somebody who's anorexic. Does this look like enough, to eat for you? A lot of students would say, absolutely not. This might be like a snack, and you'll notice that the things that are similar here are the types of foods. They're all considered to be, quote, healthy foods, right? You have fruits and vegetables, and I don't know what kind of bagel this is. It looks like a smaller bagel, maybe smaller serving size. There's light fat-free yogurt. It all sounds great. But here's the thing, is that if you refer back to the video, you'll notice that Rudine, everything was a number to her. So all of these things are very low-calorie foods. They're also fat-free foods. I don't know about this bagel, but I'm assuming it's a very low-fat or fat-free type of bagel. So that means that, again, everything in your brain when you're anorexic is just a number. You're so scared about gaining weight that you will calorie count like crazy throughout the day. So you're obsessed with it. It's a good word. It's an obsession of calories and making sure that you're not having any. In terms of the physical effects of anorexia, you look very skeletal. You have a skin and bone appearance. You look like a walking skeleton, and that's what they referred to Rudine as. And you saw that. I mean, her bones were, protruding. Her skin was sunken in. She looked like she was, 80 years old, even though she was in her 20s. So it's, as you can tell from that video, I mean, my goodness, nutrition is of the utmost importance, and it's so important to get all those nutrients in your body to prevent disease and prevent, any, illness and bad things from happening to your system. I mean, her organs literally shut down, so that was not good. One other thing, too, that's not listed here, it might be on the next slide. Yep, it's called lanugo. And lanugo is the hair that babies are born with. You may have even seen this before if you have a family member, a close friend that you've seen their newborn baby. The baby sometimes is hairy. I know it sounds kind of funny, but what happens inside mom, when the baby is being formed, they grow these long, thin hairs all over their body called lanugo. And its main function is to keep the body warm. So it makes sense if you are anorexic and your body fat percentage is so low, because remember, if you think about when we talked about fat in our fat chapter, one of the main functions of fat on your body is to insulate your body. So if you don't have that insulation, again, your body is in survival mode, starvation mode, so it will do everything it can to protect itself. It will start growing back these long hairs that you had when you were a newborn. lanugo, and it happens all over your body. So if you get up close to somebody that is anorexic, you might notice these long, thin hairs all over their body. You wouldn't be able to tell from far away, but they're up close you would. So let me go back here. Let's see, what else do I want to tell you? I think that's pretty much it. Again, lowered body temperature, which makes sense. Your skin is not going to be well nourished, so it's going to be rough and dry because of the lower body fat percentage. Depression is a common theme seen throughout all of the eating disorders. That is not just for anorexia. You will notice as we go through, depression is usually one of the underlying causes for eating disorders. Loss of teeth. This often will happen in anorexics just because of lack of nutrients. It will also happen in bulimics because of other reasons, which we'll get to. And I mean, just overall not healthy. Osteoporosis is also a big one here. Osteoporosis, when you are anorexic, and if we go back to last week when we talked about minerals, you'll remember that one of the things about calcium is that you have to have it during your teenage and adolescent years in order to build up that bone tissue. And so if you, and the age group in which anorexia strikes is typically those teenage years into the early 20s. And it mainly targets women. And if you look at like the statistical breakdown, it's more women that are affected than men by far with anorexia. And because of that, if you're not getting the calcium and vitamin D that you need during those years because you're lacking food, you're basically setting yourself up for osteoporosis later on in life, big time. So you can't go back, and you can't go back in time and start increasing the calcium. It doesn't really work that way. So treatment for a person with anorexia, you'll notice that the treatment options for all of these are pretty similar. It's basically looking at a multi-pronged approach of your doctor, your dietitian, your psychotherapist, or somebody who is a trained person with therapy, specifically with anorexia or with eating disorders. You have to have, it's a team of people in order to combat this situation. It's a very, very hard thing to overcome. Specifically, if you think about somebody, I know I mentioned it earlier, how it can be connected to like an addiction type of problem. Think of somebody in your life or somebody that you know that has an addiction. It could be to drugs, alcohol, gambling, anything. And it is very hard to overcome it in general, right? So you have to usually have some sort of treatment plan, and a lot of people just don't quit, cold turkey. It's a habit, and people have become addicted to it. So it's the same thing with eating disorders. It's a habit. It is something that they've become addicted to. You can't just stop one day. It doesn't work like that. With somebody with anorexic, you can't just tell them to eat, and it's all, everything's good. It is something that it takes about, I think it's 5 to 7 years to overcome. And even when you do overcome the symptoms, it's not a full recovery oftentimes. It's a partial recovery. And you can have relapses, as we saw in the video, okay? Let's see, we talked about that. Psychological therapy, like I mentioned, usually antidepressants are prescribed for these individuals because depression is an underlying cause of eating disorders. Okay, let's talk about the next one, bulimia nervosa. So make sure you jot down all the characteristics of bulimia nervosa. So this one can be characterized as binging and purging. So let's describe what that means. So binging is basically when you're eating a lot of food in a very short amount of time. And this can happen several times. Again, it's like an addiction, so it happens several times over. Now, let me explain the cycle for this. What happens when you're bulimic is you go to work, you have a bad day, you come home, you go straight to the freezer, you grab the ice cream, and you just take a spoon and you start eating it right from the carton. And you're not stopping, and you do it until the whole thing is done, right? That is a bulimic episode. Now, you're done with the ice cream, you feel so guilty about what you just did. So you want to do anything you can to try to get rid of all those calories. So there's a few different ways you could do it. If you look down here on compensatory behaviors, you'll notice that vomiting is usually the way that you would do it. You might also use laxatives, which help you go to the bathroom. Number 2, excessive exercise to the point that you are running as fast as you can. All you're thinking about is burning all those calories to get rid of all the calories that you just consumed. So it's different than just going for exercise. This is a feeling of guilt and trying to get rid of those calories. The thing with bulimics is that physically they look normal. Oftentimes they don't look like they're underweight. They don't look like they're obese. They may even look a tad overweight if you had to judge somebody from the outside, which again in this class we're not doing, but I'm just trying to explain what bulimia nervosa looks like. So because of that, it's really hard to diagnose somebody who is bulimic. It's the hardest one out of all these eating disorders. So looking at this picture, this would be an example of a bulimic binge. And this obviously looks completely different than the anorexia photo that I showed you with the apple and the bell pepper and all that. This is like the opposite end, right? You have the unhealthy ice cream, and I'm talking you would eat the entire thing. All of the Reese's peanut butter cups, all of the Oreos, and you'd eat it in a very short amount of time. So you're shoveling food in your mouth. While you're shoveling the food in your mouth, you are not enjoying it. You're not enjoying the flavor. You're not sitting there going, oh, these Oreos taste so good. What you're doing is you're trying to suppress the feelings that you have inside of you, whether it be anxiety, depression, something bad that happened that day that didn't go your way. You have those feelings, those emotional feelings, and you're trying to suppress those feelings with food. And so that's how the binge begins. And then it's followed by the guilt, and then you're trying to get rid of it through the purge. So these are some common behaviors of bulimics. Again, the hidden binge and purge habits, like I mentioned before. The behaviors of a bulimic, very, very common for them to hide their food. So if you're interested, there's so many documentaries out there about bulimia, and you can search them on your own. But they oftentimes will portray people that have hidden food in drawers, under their pillow, under their bed, in their closet, behind things, because they don't want anyone to know that they have this bad habit. And this sounds kind of weird, but sometimes they even will save their vomit in a glass mason type jar to have it as a trophy. And it's kind of like yes, I got rid of these calories that I just consumed, and I'm going to keep it. Sometimes they actually hold on to it just to remind them of that. And I know for somebody who is not in this situation, it seems odd. And why would somebody do that? But when you're in this mode, like we saw in the video, that's why I like showing that video, is that person is not being realistic. They're not able to make rational decisions, obviously. They're in their head. They're not outside of that, if that makes sense. So that's exactly what's happening with bulimia as well. You'll notice that the binge consists of a lot of calories, oftentimes more than 3,000 calories in one sitting. So it's oftentimes the high sugar, high fat foods like we just showed. And it's a loss of control. You have no control. You're binging to a point, while you're binging, you're thinking to yourself, I should really stop this, but you can't. And so that's a big sign that something is going on. So it's really important to get a hold of that and reach out for help, because there are programs out there that can really help individuals with breaking that cycle, which is really important. Okay, purging again could be vomiting. That's the typical way usually, but there's other ways, laxatives, like I mentioned, excessive exercise. It doesn't say on these slides, but you can also do like enemas, which is basically where you clean your intestines from the other direction, if you're going up the back way, so to speak, and cleaning it out. So that would be another way that someone would do that. There's also something called diuretics. Diuretics make you urinate, and so they get rid of water weight. That would be something also that's common with bulimic as well. So if you notice anyone that's close to you that's buying these products, or you notice some of these, maybe these behaviors, they might be dealing with something internally and it's coming out in a bulimic type of way. Okay. As I mentioned before with anorexia, it's a very small percentage of men compared to women that have bulimia. And typically, if I were to ask you in class, one of the big questions I ask is, why is that? Why is it more women than men for these eating disorders? And the answer to that question is usually, which everybody is totally on topic with this, is that women seem to be geared more towards having that ideal figure. You know, when you look at like magazines and there's women on the front with bikinis on and looking a certain way, and there's not a, you know, an ounce of fat on her body type thing, women have this pressure to have this certain type of body, where men don't as much. Now, men could be towards the other end of the spectrum, because I know I've had students share this before, that men oftentimes feel that they need to look a certain way in terms of bulking. So they need to have muscles and they need to have that six pack and all that. So that can also come into play in this, and why somebody needs to look a certain way and why somebody would have an eating disorder. So that makes sense. Here's that cycle that I was telling you guys about, how, you know, you have an emotional trigger. Maybe in this case, we'll say anxiety. It starts the binge where you can't stop. And then while you're binging, you feel terrible about all the calories you consumed. And so now you feel like you need to purge. And now what happens is there's a loss of fear of fat gain. And so you go through the guilt, and it just, there's a lot of guilt and shame involved in here. And so it's really important to break that cycle. And we'll talk about that actually when we talk about the binge eating disorder, because there's a method you can use with that. The effects of bulimia, obviously, you know, you are consuming so many calories, 3,000 calories plus at one sitting. So there is weight gain oftentimes, because your body just can't purge everything when you go to purge. Some is absorbed. So it says, yeah, look at this. 33 to 75% absorbed after vomiting. So even though you've eaten a ton, you're not getting rid of 100% all the time. Depends on how much has been absorbed into your system before you purge. And then with laxatives, only 90% is absorbed when laxatives are used. So oftentimes, this person, like I mentioned, could look a little overweight to somebody else who is maybe looking at them from the outside perspective. Because of the ups and downs of the calories here, where you're, you know, withholding calories, and then you're binging, and then you're purging, and it's going back and forth. There's obviously a fluctuation in weight weekly. You know, you're going up and down constantly, and that's not good for your body. One of the physical effects of bulimia, where you can tell somebody's bulimic, is if you look at their mouth. Because if you think about it, if they're vomiting often, that stomach acid is going to erode the tooth enamel. So their teeth often look horrible, and loss of teeth happen often with these people. If you look down their throat, that might look like there's burns down their throat. If you look at their fingers, this doesn't say this on the slide, you might notice their fingers look like they're raw or very dry on the index finger, because they're using their fingers to try to promote the purging process where they gag themselves. And sometimes they are doing it so much that they can't use their finger anymore. They've got to use an object. So they now, you know, are turning to spoons and things like that to try to gag themselves. So that is very, very common with somebody who is bulimic. So that's something to look for, is their tooth health. Dentists oftentimes can look right away and tell if somebody is bulimic just by looking at their tooth enamel. Okay, treatment is going to be very similar to anorexia, where you need to have that multi-pronged approach. You need to have a dietitian involved. You need to have the therapist involved, really, really important. Antidepressants are often prescribed because, again, eating disorders are fueled by emotional disturbances. It's not by the food itself. Food is just an outlet in these situations. If you've ever taken psychology, you'll understand that as well, because they talk about the psychoanalysis basically that goes on with somebody who has an eating disorder. It's so interesting. Okay, now the recovery rate for bulimia is only 50%, which is a little bit better than anorexia. But it's estimated that it says mortality rate for patients with bulimia is estimated around 0.4%. Sounds low, right? But that's still lives right there, because what's happening is you are destroying your insides so much. Your organs can only take so much of going back and forth with all these calories and lack of calories. All right, the next disorder is called binge eating disorder. So make sure you jot down some characteristics for this one. As you can probably assume, binge eating disorder is literally just the binging and no purging at all. So somebody who has binge eating disorder often is morbidly obese, or definitely in the obese category if you're to look at the BMI. And because they're only consuming large amounts of food, in order to be diagnosed with this, you have to have, I believe it's 2 binges per week for at least 6 months is what it is. So it's something that is consistent. It's not just a one-time thing and then you're done and you never do it again. You have to do it often. And so the good news about this disorder is that it's the most treatable out of all the eating disorders. And I'm going to show you why that is in a second. It kind of makes sense. But again, emotional disturbances is what's triggering the binge. Usually it's binging on junk food. You're not binging on apples and carrots and oranges and things like that. You're binging on things that are not good for you. The treatment for this is different than the other two that we just looked at. So, obviously with all the eating disorders, we need to have the multi-pronged approach. Absolutely, that's so, so important. And the one thing, and antidepressants, again, is usually prescribed. The one thing that's very, very helpful with all these eating disorders, I don't think I saw it on the other slides, but there's a group called Overeaters Anonymous that is pretty well known here in the United States. And it's basically a group of individuals that you can go to. I'm sure they have them online now too, especially right now, where you can have an online support group and you can talk with other people that are going through the same thing as you. And that is so helpful. I don't know if anyone in here has ever done a support group for anything, but it makes you feel like you're part of a group of other people that are experiencing the same things as you. And you feel good. You feel good talking to other people that can understand you and where you're coming from. So it can really help with the healing process and help to overcome, because once you see somebody that has the same addiction or has the same problem as you, and you see that they are able to overcome, it is such great motivation for everybody else. And they are there to provide a support because they've been in the same place as you have, and etc. So all of these have eating disorder support groups depending on what type of eating disorder you have, and can be really, really helpful. Obviously, like I mentioned, most people are obese, and because of obesity, comes along with all these different horrible problems like we've already talked about: hypertension, high blood pressure, cardiovascular disease, type 2 diabetes, etc. One thing I'm going to show you here, let me move forward. This is all stuff we've talked about, is this. This is important. This is the binge eating disorder food diary. This is key in the treatment for this particular disorder. And I'm going to show you an example here of what I mean. So if you are going through therapy and you are sitting there with your psychiatrist, they're going to have you complete a food diary. Your dietitian may also have you do this as well. They'll work together. But they're going to have you write down, very similar to what you guys just did with your diet analysis, writing down what you had to eat for breakfast, lunch, and dinner, any snacks, and then also for this, the time of day. The big difference here is writing down your emotions while you're consuming these foods. So let me show you. For this person at 7:30 in the morning, they had 2 cups of coffee, 2 teaspoons of sugar, 2 cups of cornflakes, 1 cup of skim milk. They categorize it as a meal. You can categorize it as a meal, snack, or binge. And the feelings at the time is they were feeling hungry. Okay, seems pretty normal. At 11:30 a.m., they had a tuna sandwich, 2 cups of iced tea. They also categorized it as a meal. They were bored, okay, but they also felt hungry at this time. This is where it changes. At 7:30 at night, they had 3 hamburgers, 2 large fries, 24 Oreos, and a half-gallon of ice cream. This they categorized as a binge. They were feeling stressed and they were feeling angry. So from this whole situation, they can now realize that when they are stressed and angry, that is what is triggering that binge for them. So now that they know that information, they can go ahead and take that and use it to their advantage. They can slowly but surely start making those small baby steps in replacing this binge with something that's a healthier option. And it's so incredibly important to do these food diaries for these individuals, because oftentimes they go throughout their day and it's just so cyclic they don't even realize that they're doing these things until you actually write it down. Just like with you, when you guys did your diet analysis and you wrote down your food log, I know many of you have said that this was very eye-opening and that you learned so much by doing that assignment. It's the same thing with this. We don't typically think about our food choices throughout the day or why we choose them throughout the day. We just do it. And so when you really stop and think about your emotions and what's triggering your food choices, it really makes sense and can be so helpful for especially dealing and healing from these types of situations. Again, this is very repetitive pharmacological therapy. Basically, what drugs you're going to use to help support the treatment of this. And in this particular one, again, antidepressants, that's the big one for all of them. And it's mentioning that anti-seizure medications can actually reduce depression and triggers. So just dependent on the individual, obviously your doctor would know best, and they would do a full evaluation to see what medications would be best for this situation. Okay, the last one, and this is usually everybody's favorite eating disorder when we're in class. If you've ever seen the show, My Strange Addiction, sorry, I forgot what it was for a second. It's called My Strange Addiction. Look it up. There are so many cases of pica happening on there. It's basically where somebody eats non-food substances. So it could be clay, dirt, ice, chalk, wood. I've seen nail polish. I've seen gasoline. I've seen glass. Someone was breaking like champagne glasses and just chewing them up and eating them. Anything that's considered to be non-food items is pica. Now, obviously, from eating non-food items, you can have very serious health consequences. You know, glass should not ever go inside your body. That will cut up your insides. A lot of these things are poisonous to your system if they have chemicals in there. So these individuals are not thinking about those consequences. They're just doing. And when you start doing a psychoanalysis of these individuals, they have some very deep, disturbing situations oftentimes. And I have a video for you guys here. If you're click on it if you're able to watch it when you go into the presentation. I'm not going to show it right now. But if it doesn't work, sometimes it works, sometimes it doesn't work. Just go ahead. I would look up My Strange Addiction and look up pica and find some videos on there, and you'll see some real life cases of people who are eating non-food substances. It's very, very interesting. Drywall's another one, couch cushions, and again, they go into the background of why these individuals are this way. Okay, let's see. This is something that's interesting. I'm not going to test you guys on this, but this is called the female athlete triad. Oftentimes, girls, young girls who are highly athletic will experience this. And it's lack of menstrual periods, osteoporosis, and disordered eating. And it all makes sense. They all go together. So if you have an eating disorder and you're in your teenage years and you're not getting the calcium and vitamin D that you need, that's going to result in osteoporosis later on in life. Lack of menstrual periods, now your hormones are being disrupted. That's also going to result in osteoporosis, as well as some other issues for you as a young girl and not having your menstrual periods. So it's called the female athlete triad, and they often go hand in hand. It's like a little circle there. I know plenty of girls. I'll give you a personal situation. When I was in high school, I ran cross country, and you're burning, lots of calories when you're running cross country because you're running miles every day. And I knew so many girls that did not have their menstrual cycle because their body fat percentage was so low that they weren't menstruating anymore. And I remember at the time, girls being excited about it. But when I look at it now, now that I know all this information, it's not healthy. And you're not getting the hormones that you need. You're putting yourself at highly increased risk of osteoporosis later on in life. And so it just is a bad, slippery slope to go down for sure. Okay. Let's see. I'm not going to go over the rest of this. This is kind of interesting. This is actually a clipping from a magazine, and how this is just a discussion that we would have in class. I would ask you guys what you thought about this picture, because depending on who answers it and how you look at it, some people look at it positively, some people look at it negatively. I'll let you guys just soak this in yourself, and you just reflect on what you think about it, because there's two different sides of how you could look at this. Okay. And then the Dove Evolution commercial, I'm going to post this so you guys can see that, but it's also within this PowerPoint as well. All right, guys, that's it for Chapter 11. Let me know if you have any questions about anything. And Let me see here. I get it here. Okay. If you have any questions about anything, please don't hesitate. I've helped a few students last week over Zoom. If you want to do a face-to-face like conference call, I'm totally fine with that. Otherwise, it's going to be a pretty straightforward week, and I think it'll be a great week. Okay, thanks, guys.